Hello, so we'll talk about manual resuscitator. Number of times in hospital, out of hospital, when a patient needs emergency ventilatory support, we need a device which should be portable, which should not depend entirely on the pressurized source of air, and it should be not electricity dependent. Now, all these characteristic is fulfilled by our handheld manual resuscitator. Now, this manual resuscitator, what we need to know is what are the parts of the manual resuscitator, how we use it, and what is the oxygen concentration which can be delivered by it. And we also need to know when we are using it, how to check it before the use. So all these things are required to be discussed in this topic. One very important thing I want to tell you that manual resuscitators, which comes in adult, pediatric and infant size, should be mandatorily present in our OT before any case we take under general anesthesia. It should be mandatorily present in ICU, and it should also be mandatorily present in wards. Whenever a patient would require emergency ventilatory support, this would become a very useful device for us. So let us discuss manual resuscitator. Now, there are a number of companies which are making manual resuscitators. Now, plethora of companies are there, though the parts are same, but there is little differences, right, which I'll talk about. Now, first manual resuscitator was designed by a German company, that is Ambu. So in 1956, Ambu, a German company, designed manual resuscitator, which is popularly known as Ambu bag. So because Ambu was the first company who came up with manual resuscitator, so this Ambu kind of became synonymous with manual resuscitator. Ambu, that is artificial manual breathing unit, right? Now, as I said, manual resuscitator are portable device. They are portable device, does not rely on source of pressurized oxygen, pressurized gas or oxygen, whatever, and does not need electricity. So electricity independent. So all this make it a very handy handheld device for resuscitation of a patient, for ventilation of a patient in emergency. So what are the parts of this manual resuscitator? As you can see, it is in my hand. It has three main parts. First is this bag. This is a self-inflating bag. So I'll talk about the parts, and the first part I said is a self-inflating bag. So what are the characteristics of self-inflating bag? I'll talk. Then just on the opposite end of self-inflating bag, there are two very important parts. One part which is towards the patient constitutes of non-rebreathing valve, and the other part, the other end, is the gas inlet, the inlet through which the gas will come in the bag. So three important part: the self-inflating bag, I'll talk about, a non-rebreathing valve which is towards the patient end and it is attached to the mask. Then we have a facility for admixture of oxygen and air, that is the inlet, the respiratory inlet of the manual resuscitator. So these are the three important parts. So I will talk one by one about all the parts. Let us first discuss the self-inflating bag. So what is the characteristic of the self-inflating bag? Now, this self-inflating bag is made up of either silicone or PVC. PVC ones are mostly the polyvinyl chloride, ones are mostly the single-use one. Silicone one is what we can reuse after steam autoclaving. So this is made up of PVC or silicone, and the wall of the manual resuscitator is thickened and thick, and it is reinforced by ribs inside its inner circumference. Ribs are made of same material of which this bag is made, that is of silicone or PVC. So because of this ribs present on the inner circumference and the thick wall, when we press it, right, it gets pressed, and when we release the pressure, it comes back in the resting position. So that's why it is called self-inflating bag. It comes back in the original position. See, I haven't attached any source of gas to it. I'm just pressing it and it is coming back in its original position. So it's self-inflating bag. What all points did I tell? First point, I told that it is made up of silicone rubber or PVC, and it is strengthened either by making the wall thick or by incorporating circular ribs. So it is strengthened either by making its wall thicker, or by incorporating circular ribs of identical material. So it is reinforced by a circular ribs of identical material to bring it in the resting position. So in resting state, it is expanded. So it is always expanded in resting state. Now, Ambu company, they have a different kind of self-inflating bag which is made up of chloroprene or butyl rubber, and the inner circumference doesn't have a circular ribs. It is reinforced by a foam to keep it in self-expandable position. So for Ambu, the outer, it's the newer Ambu resuscitators, outer covering is made up of chloroprene or butyl rubber, right? And the inner circumference is lined by thick foam. Thick foam makes the inner layer. So mostly nowadays, both Ambu Resuscitator and there are other companies, one of the most popular one is Ladle. Now, both are in clinical use. Mostly Ladle is the more popular one. The silicone rubber, this can be reused number of times after steam autoclaving, and PVC is mostly the single use one. So this is self-inflating bag, the first part of the manual resuscitator. The second part I would discuss, which is mounted on the other side of one side of the manual resuscitator, that is the gas inlet. So I'll talk about the respiratory gas inlet. Okay. Now this respiratory gas inlet has multiple component. So I have made a diagram and I would show you what are the component of this gas inlet. So starting with A, the first part of the gas inlet. Now this would be visible. This can be visible when I am seeing from this side because it is transparent. My Ambu bag is transparent, but many times it is not visible. What is this A? Now this is one-way flap valve. Now this one-way flap valve, this closes the bag. Closes the bag when we press it. So when we are pressing it, this one-way flap valve, this goes back and it closes the bag. So what will be the benefit? That no air will escape from bag back into the inlet. So air would not escape out and the pressure would be maintained for the ventilation. So the first part, as I said, is one-way inlet. The A is the one-way flap valve. Now this is fitted on the inlet, of the self-inflating bag, So what is the benefit? When the bag is squeezed, the inlet closes the bag. So when bag is squeezed, the pressure inside the bag, rises, and valve close. Now this was prevent any escape of gas out from the bag. So this valve closes and this prevents the escape of gas, And the other, when the pressure is released, so when I apply the pressure, the inlet closes, and when I release the pressure, the valve come back in its original place, and through this valve, the inlet, the gas comes back in the bag, right? So when pressure is released, fresh gas from inlet comes in the bag, So this is our one-way flap valve, which is for covering the inlet of the bag. Okay, then come on the part B. Now this is a small bore nipple to which the oxygen is applied, oxygen is attached. So this is small bore nipple to which we attach oxygen. Also oxygen is mounted on it. Okay, so this is the nipple. The third is your C part. Now this is a wide bore inlet. You can see this is the wide bore inlet, which will allow the mixture of oxygen and air to go through this one-way flap valve into the bag, or it will allow only the oxygen if the supply of oxygen is more than what is required for the minute ventilation of the patient. So this is C, this is wide bore inlet, okay, and this supplies oxygen alone or oxygen plus air or air alone. So this supplies oxygen or oxygen plus air. Okay, so this is your wide bore inlet. Now coming on the D part. What is D part? What is attached here? A reservoir bag is attached, right? Reservoir bag is an attachment which is nowadays present in most of the manual resuscitator. It helps us in increasing the oxygen concentration which we give to our patient. So D is the reservoir bag. So this is reservoir bag. Okay, so this is reservoir bag. So as the name suggests, this reservoir bag stores oxygen. This will store oxygen, right? Then through the reservoir bag, there is two more important parts. Number one, this is the F and this is the E. First E. This E is overflow valve. If lot of pressure is generated in the reservoir bag, this flap valve open and releases the pressure. So E is the overflow valve which prevent excess pressure to be built in reservoir bag. And F is the entrainment valve, which allow the ingress or taking in of the air in case adequate oxygen is not stored in the reservoir bag. So these are the parts of our respiratory gas inlet. Now depending upon the minute ventilation of the patient, depending upon the storage of gas in the reservoir bag, oxygen in the reservoir bag, and the flow of oxygen through this nipple in the reservoir to the inlet, the oxygen concentration which would be delivered to the patient will depend upon all these factors. It will depend upon what was the minute ventilation of the patient. It will depend upon that what is the flow of oxygen which we have attached to this inlet, 2 liter, 4 liter, 5 liter. It will depend upon how much is the oxygen stored in the reservoir bag. It depends upon the size of the reservoir bag. Bigger the size of the reservoir bag, more oxygen concentration we can increase giving to the patient. So all this I will discuss. So this is your respirable gas inlet. Now let us talk about the other side of the respirable gas inlet. What is on the self-inflating bag? It is the non-rebreathing bag, non-rebreathing valve, right? So I'll talk about now non-rebreathing valve. This is on the opposite end to the respirable gas inlet. So this is present on the opposite end of bag to gas entrainment system. Bag to gas entrainment system. Now it is made up of number of components which ensure that during inspiration gas from the bag enters the patient inlet only and ensures during expiration, the expiratory gases does not go into the bag, that is, the rebreathing is prevented and all the expiratory gas goes into atmosphere. So this has number of component. I'll talk about number of component. Okay, number of component to ensure two important thing, that during inspiration gas flows out of bag to patient port only, right? To patient port only. So definitely the expiratory port has to be closed. Then during expiration, what happens? Valve ensures the gas flow out of expiratory port only. It does not get collected in the reservoir bag. So valve ensures gas flow out of expiratory port, right? Now, most of the non-rebreathing valve works on the same principle. Non-rebreathing, that means the expiratory gas will not collect in the reservoir bag. It will not collect in the reservoir bag. Got my point, everyone? Okay. So this is the importance of this non-rebreathing valve. Now we'll talk about two very important manufacturers, non-rebreathing valve attached to the manual resuscitator. Ambu, the first company which came up with the manual resuscitator. I'll talk about the shutter valve of Ambu. So Ambu shutter valve. Okay. As the curtain shutter, it opens and closes. So this is a very simple, all current Ambu devices have this shutter valve. Okay. Now this shutter valve can be repeatedly reused after autoclaving, and to this peep valve can also be attached. So during expiration, the expiratory port, we can also attach the peep valve, right? Peep valve can be attached, which can apply a positive pressure, which can make a positive pressure in the alveoli. Okay, so this is your Ambu shutter valve. As you can see, this is the Ambu manual resuscitator. This is the self-inflating bag, and this end is your non-rebreathing valve, and this is how the non-rebreathing valve works during inspiration and during expiration. So I'll explain, and we can visualize the movement of the non-rebreathing valve's movement because it is mounted in a transparent sheet, right? So we can visualize it. It is mounted on a transparent sheet. And during checking of the valve also, we have to check it by visualizing the movement of the valve. So during inspiration, what happens? So this is the inspiratory port. Okay. This end is attached to the bag. Okay. This end is attached to the bag. So when this bag would be squeezed, then a pressure is applied on the shutter valve and the shutter valve opens. The shutter valve opens and the inspiratory gas, what is coming from the bag, would enter only the patient end. What will happen? The concave portion of the shutter valve, it occludes the expiratory port. So here it is occluding the expiratory port. So during inspiration, what is happening? During inspiration, what is happening? When we are applying the pressure is applied on the bag. This moves the shutter valve. This moves shutter valve forward, and this movement of the shutter valve causes the concave part to occlude the expiratory port. So as you can see, the expiratory port is now occluded. So no gas will go through the expiratory port. The gas will come to the patient. Okay. When the pressure is released, and when passive patient exhalation happens, because of the exhalation, what will happen? Again, this convex portion of the valve will move down, and this will occlude the inspiratory port. This will occlude the inspiratory port. And from the patient, when the patient is expiring, the pressure applied by the movement of the expiratory gas coming into this valve pushes the shutter valve towards the bag. So it is pushed towards the bag, and the expiratory gas comes out of the expiratory port, right? So again, if I make it in a more clear way, okay, so let's say during inspiration, when the pressure is applied on the bag is squeezed. This concave portion of the shutter valve occlude the expiratory port, and the inspiratory port opens and the inspiratory gas reaches the patient. When the pressure is removed from the self-inflating bag and patient expires, the expiratory gases which comes out in the valve applies the pressure, and this convex portion occludes the inspiratory port, and the expiratory gases go out of the expiratory port into the atmosphere. So this is how this works. Okay, so this is your AMBU shutter valve. Now this is mounted on silicone bag, or it is mounted on your, let's say, PVC, or it is mounted, as I said, the latest AMBU bags are made up of a very important new material, which is your the chloroprene or butyl rubber. Okay, so bag of the AMBU can be made of any of these three materials. Now, more popular and more efficient non-rebreathing valve which we are using today comes with the ladle pattern of valve. Comes with the ladle pattern, right? So ladder pattern of valve. Now this is a very high efficiency valve. High efficiency valve, and this is called duck billed valve. Duck billed valve. As you have watched the beaks of the duck, as the beaks of the duck open and close, this valve also open and close. It has multiple parts. So duck billed valve. This is called duck billed valve. So what does it comprises of? What are the parts of this duck billed valve? So this is the duck billed valve. This is the seat of the duck billed valve. So I'll talk about it. Okay. So it has three important parts: duck billed, inspiratory and expiratory valve, then valve body, and the non-returnable, let's say, expiratory port. Non-returnable flap valve expiratory port. Okay, so non-returnable flap valve expiratory port. Now these are the parts of this duck billed valve. How does this duck billed valve works? So as you can see, this is the duck billed valve. What happens during inspiration? During inspiration, what happens? The central duck billed valve, right? The central duck billed portion of the main valve opens when attached self-inflating bag is squeezed, or when the patient breathes spontaneously. The outer disc portion of the valve is pushed against the aperture, thus sealing the expiratory pathway. So during expiration, what happens? That this is where the bag will be attached. So what happens when we squeeze the bag? The gas from the bag enters and open this duct. Pressure is applied on the central portion of the duct billed valve. It opens and gas goes into the patient. So what happens? The non-returnable valve, this closes the expiratory port. Right? When the duct billed valve is open. Okay. During expiration, what happens? Positive pressure from the elastic recoil of patient's lung causes the duct-billed section of the valve to close. So now the duct-billed section which was opened, from this side, when the positive pressure gas is coming with a positive pressure, this duct-billed portion closes. This closes, so the non-returnable valve gets lifted up. This non-returnable valve gets lifted up, and this opens the expiratory port. And expiratory gases goes into atmosphere. So escaping valve lifts the flap of non-returnable valve in the expiratory port and expiration happens. So this is how the working pattern of the non-rebreathing valve work is operating in the Lardell system of duck-billed valve. Okay, so this is our non-rebreathing valve. Now there are some more important features of non-rebreathing valve that we have to know. We need to know that non-rebreathing valve, the patient inlet portion